This next slide deals with ophthalmic medications. Obviously, this slide covers the safety aspects of meds in the OR, most of which you already know, so let's review. Medication usage varies according to type of surgery, which is no different in this unit. They are always, always, always labeled immediately upon receipt and identified with the surgeon. That's all meds, all the time. Some additional considerations include they can be instilled or injected before, during, and or after surgery. You may have 4 or 5 syringes of meds lined up, each serving a very different purpose, all looking exactly the same. And so it's for this reason that the worksheet that you received at orientation has been created for you to study the most common eye meds used, what they're used for, and don't shortchange yourself on this assignment. Allow yourself enough time to complete it thoroughly. Instrumentation in ophthalmic surgery is very delicate and very small. You'll see a wide variety of eye instruments that have been donated to the program from a very generous facility. Know that it is your responsibility to examine the instruments for damage before and after every single use. Think about the patient. Would you want a microscopic imperfection on an instrument inserted into your delicate eye? I don't think so. I'll show you a simple technique to check these instruments in class. Know that it's not uncommon for eye procedures to be performed in a dimly lit room. It's very important for the scrub tech to have an organized setup and know where each instrument is located all the time. This next slide is one you'll want to pause on for a few moments and find and identify the instruments listed. For the forceps and scissors listed in fuller, over here, doot, doot. Look at them and note any differences you see that make them identifiable. We have some of these instruments in our collection, although since they were donated, they also donated a lot of uncommon instruments. But you're going to get to look at them all. Some common equipment and supplies you'll see include the ESU, and know that it is often in the form of bipolar cautery and can also be a part of the phacoemulsifying machine. Also, ophthalmic procedures will employ the use of Weck sponges, which are found on page 665. These sponges are lint-free and extremely absorbent. I recommend storing them in a location of your mayo that is guaranteed to be free of fluid, because once they are even the slightest bit wet, they are no longer useful. You will use several of these, and in my experience, they aren't counted. The sutures used in ophthalmics will be very, very small and should be handled as little as possible to prevent damage and to keep the points protected. Lastly, the dressings commonly used in these procedures include eye shields and pads, instead of the bulky absorbent dressing you've become used to in many other specialties. These next 2 slides pertain to the usage of the operating microscope. You may have experienced the use of the operating microscope before, and the concepts I'm about to discuss can apply in those specialties as well, but know that it is almost a certainty that the microscope will be involved in these procedures unless you're working strictly on the soft external tissues. Some key things to remember are that it should be damp dusted prior to use or at the beginning of the day if it's in the room. Most manufacturers indicate exactly what types of cloth or sponges can be used on the lenses. The microscope should be adjusted for height and placement over the patient by the surgeon just before scrubbing. It's best practice not to move the microscope long distances for no reason, as that will negatively affect the balancing of the scope. Many times, the microscope will require draping, and this is done after the patient is prepped and draped. Occasionally, you'll encounter facilities that utilize handle covers, very similar to light handle covers, and they put those on the microscope instead of a drape. It is facility specific, and you need to know what to expect so that you're prepared for your case. It's recommended that you limit your caffeine intake before scrubbing for an ophthalmic procedure to keep your hands steady. You must pay very close attention to the case so the surgeon does not have to look away from the microscope. When surgeons have to look away from what they're focusing on under the microscope, they can lose their place, their concentration, and potentially cause inadvertent injury to the patient. It's hard for your brain to adjust that quickly, so don't make them have to do it. In some facilities, the operative microscope will have opticals available for the scrub tech to use during the procedure. You must be careful not to bump the microscope during the procedure and realize that your usage of the scope could make it hard on your brain if you're going back and forth between using it and not using it. So take that into consideration. Your number one objective is to keep up with the procedure and give the surgeon what they need. This ensures that the patient receives the best care possible. So I want you guys to read your chapter and be prepared for your first day back. It's going to be a shock to your systems. I'm planning to improve the homework day by having some activities planned for the first hour or so on that day. We also have to start thinking about the fact that you're going to graduate this year. This will be a chunk of time devoted to some necessary paperwork so you get to walk across that stage in May. I'll see you soon.